Hello, everyone, and welcome back to the CLSR, and I'm your host, the counselor. Today, we're going to be talking about low sexual desire. And quite recently, over the last few decades at least, men have changed. The role has changed in the household. Many men have taken on more an inclusive role in the household, helping rear children, taking on responsibilities around the house. However, it has had its consequences, and one of the consequences could be low sexual desire. Now, not all men, but it seems to be a pattern out there. And I do recall a client who's very frustrated in his relationship right now because his wife keeps referring him to see a doctor. She's complaining about him not having sex in a 3 to 4 month period, not being affectionate, just going through the motions. He won't acknowledge that there's something wrong. His wife keeps asserting that there's a problem in the relationship. However, he's just not responsive at all. And he is just one of a growing number of men who experience low sexual desire. It used to be more of a problem for women, but since men have started sharing household chores and child rearing responsibilities, more men utter "not tonight, dear," more than ever before. What is important to know is that there is no clear cut definition of low sexual desire. What may be normal for some may be abnormal for others. Generally, people who seek help for this problem report less frequency of sex, less desire for sex, fewer sexual fantasies, and lower sexual arousal. Like approximately 65% of people who seek a sex therapist report this problem. Of the 40% also report arousal or orgasmic difficulties. It's important to know that most couples experience a drop in sexual desire from time to time. It is not necessarily a problem. If it persists, a medical exam is a good idea and possibly a visit to a qualified sex therapist. In a recent study, it was reported that approximately 40% of women reported diminished sexual desire 3 months after giving birth, and after 9 months, approximately 35% of women still reported low desire. So it could be happening in men or women for various reasons. But I'm going to give you 3 reasons for low sexual desire specifically. Okay, it could be a medical condition, right? Hypertension, drugs, sedatives, glaucoma, or pain medications, hormonal fluctuations, as well as other medicines and medical conditions such as diabetes or cancer can contribute to this problem. But then you also have the personal, which is depression, which is a major cause, especially for women. Commonly, people with even a low grade depression suffer a drop in sexual desire, which is understandable. Stress and fatigue are very common factors. Anyone with the lifelong problems with desire may also have been traumatized as a child. Men with sexual arousal problems often develop lower sexual desire as a defense against having to perform. Now, you also have the interpersonal, which is relationship difficulties, which can wreak havoc with desire. Lack of frequent, tender affection and limited time for a couple to spend time together, right? Unstressed by daily hassles can be a factor. Men can separate sex from relationship problems and are less likely to have lower desire when their marriage is troubled. As the desire falls, so does that person's efforts to show affection. That is because affection is often interpreted by high desire, right? And a request to have sex, something that the low desire partner wishes to avoid. Women with low desire may have lost touch with their feminine side. They may have stopped dressing in sexy or attractive clothing. They may care little about their hairstyle and may have less time to spend with those close friends of theirs. Romantic movies or novels are not a cure but can help nudge their desire somewhat. Men with low desire may be out of touch with the masculine side. Spending time with male buddies or watching or engaging in competitive sports can be rejuvenating for them. Now, if you do have someone who has a low sexual desire, there are certain things that you need to say. but there are ways you say it. Now, I've always said how you say what you want to say is vitally important in a relationship. However, how you say it, key. Regardless of the cause, the partner with low sexual desire feels a mixture of emotions. Usually it's anxiety, anger, sadness, and guilt. The best initial approach is one of a kind concern. Think about it. Expect defensiveness. Be prepared to make a repair, right? Think about that. We talked about repairs early on in our podcast. We talked about how to repair, right? Have those discussions that are not easy for each party, right? And there's certain things you say. And I'm going to give you some examples. Like, we don't make love nearly as much as we used to. Can we talk about that? Or, I can't help but notice how often you pull back when I want to make love. At first, I thought you were just tired or stressed out. Now I'm worried there's more to it. Please let me know what's going on. See, if your partner responds with, there is no problem, or is sex the only thing you care about, or do we have to talk about this now, you have to reply by saying, maybe there is no problem. I hope not anyway, but the fact remains we rarely make love anymore. And I'm starting to feel worried, basically annoyed. I can't make you talk to me, but I'd like to think you'll fill me in as soon as you can on what's going on. Sex is not the only thing I care about, but is the one way we get close and shut out the rest of the world. And I do miss it. We don't have to talk now, but I will want to talk about it maybe tomorrow, okay? Is that okay with you? Your partner may come up with the accusations or accusatory answers. Try to listen without interrupting, even if you think the accusations are unfair. Women, more than men, lose sexual interest when their relationship is floundering or when they don't feel particularly connected to their partner. If your partner says the following, why should I want to have sex after the way you've been treating me? Or, you haven't been that enthusiastic either. It's no wonder I've lost interest. Don't you realize all the stress I've been under? I guess not. Otherwise, you wouldn't be making such a stupid comment. Now, this could really get your defense up, so you have to be careful. Make supportive comments. And how you do that is by replying simply by saying, you're right, maybe I haven't been the nicest person. Maybe I'm frustrated too. Can we figure out a way to put things back together? I hadn't realized I wasn't enthusiastic. It always meant a lot to me. I'm willing to show more excitement, but I still wonder if there's more to this problem. See, stress can make anybody lose their interest in sex, but this has gone on so long and this is interfering with our closeness. What needs to happen to improve this situation? Many people with low desire go through the motions but feel inadequate, that they cannot be more enthusiastic. Then they avoid sex, at least in part to avoid feelings of inadequacy. See, once you and your partner have an opportunity to make love, show enthusiasm for his or her willingness to get close and be less concerned about the degree of passion. I love being close with you like this. You mean everything to me. This was wonderful. I was looking forward to it all day. I promise I won't presume anything. Everything is fine now, and I won't expect more sex. However, I do hope we can have some affectionate time together at least. It's important to keep in mind that the one with low desire often avoids the topic of sex. That's a mistake. Usually, the one with the low desire often avoids the topic of sex. Now, that's a mistake. While it isn't easy, that person should try to initiate a discussion about his or her desire difficulties, possibly by saying, I really want to feel more sexual. I just don't, and I can't explain why. However, I do love you. Or, I haven't lost my attraction to you, but I've lost my desire. I don't think about sex. I don't fantasize. I really want to feel differently. I know that part of the problem is that I avoid affection for fear you will interpret it as an invitation to have sex. How about we try to show a lot more affection while without it leading to sex. When dealing with someone with low sexual desire, it's important that we understand things that we should not be saying. And what we should not be saying is, how do you think it makes me feel when you don't want sex? See, your partner already knows that she has lost interest in sex and she feels lousy about that. If you approach your partner with criticism or harshness, make an in flight repair, right? I'm sorry, I shouldn't have spoken to you that way. I guess I'm just worried that you don't care about me and I miss making love. Can we talk about this? See, you also don't want to be saying snap out of it. See, most people want to have a healthy interest in sex. If they could snap out of it, they really would. And don't by any means say, if this is what I have to look forward to the rest of my life, then I don't know about this relationship. Now, your frustration is very understandable. However, this kind of argument won't get you what you want. If you say, there's something wrong with you, there is something wrong, yes, but it might be medical or personal or interpersonal. The tone here is accusatory, however, and not conducive to sexual passion. It's better if there is something wrong with you or with our relationship. I want to fix it because I do really love you. Let's figure out what's wrong. I strongly caution against stating, let's have sex anyways. No, it would be much better if you say, I'm hoping if we do have sex, you won't find it so unappealing, even if it isn't all that exciting. If the partner says no, that means no. No means no. Don't try to push it. Don't try to be conniving. Don't be passive aggressive. Understand no means no. But then we have to think about what can we do to boost that libido, right? We need something to help us sometimes. And I really recommend one thing is to try eating healthy. Try eating fruits, right? There's little evidence to support effectiveness of certain foods, but there's no harm in experimenting. Bananas, avocados, considering libido boosting foods, right? Otherwise known as aphrodisiacs. They provide important vitamins and minerals that can increase blood flow to the genitals, and promote a healthy sex life. Also, believe it or not, eating chocolate. Throughout history, we know that chocolate has been a symbol of desire, not just because of its delicious taste, but because of its power to improve sexual pleasure. Now, think about that. Serious. There's a study out there that says chocolate promotes the release of serotonin in your body. This can produce aphrodisiac and mood lifting effects. The effects of chocolate on sexuality are probably more psychological than biological. Also, make sure, and many of you are not doing this, you need to do this. Take your daily herbs. Next time you desire to sit down for a romantic dinner, add a little basil or garlic to your dish. The smell of basil stimulates the senses. Garlic contains high levels of allicin and increases blood flow. This may help when it comes to men with erectile dysfunction. And if you have a little bit of money, take a trip over to Africa. Yohimbine, which is an alkaloid found in the bark of the West African evergreen, has been known to work as a natural Viagra, natural being the key. Some studies suggest that yohimbine bark can help you maintain an erection. It will also enhance the quality of an erection. However, researchers say there is no natural equivalent or match to Viagra, they say. I could think that could be something that they're advocating for their own purposes. However, this natural is much preferred, the natural remedy for this. Now, you also want to boost your confidence when it comes to your sexual desire. The way you feel about your body affects the way you feel about sex. An unhealthy diet or lack of exercise may cause you to have a poor self-image. These things can discourage you from having and enjoying sex. You can also boost your self-esteem and your sex drive by shifting the focus from your flaws to your attributes, things that are good and positive about you. You can also focus on the pleasure you experience during sex. Also, if you're a drinker, stick to at least 1 glass of wine. 2 glasses of wine might be one too many. Drinking 1 glass of wine could put you at ease and increase your interest in becoming intimate. But too much alcohol can ruin your ability to perform by affecting erectile function. Too much alcohol can also inhibit your ability to orgasm. Now, take time to meditate and relieve your stress. I'm a big believer in relaxation. So, no matter how healthy you are, being stressed out is going to affect your sex drive. Women are particularly susceptible to the effects stress can have on one's sex life. Men, on the other hand, sometimes use sex to relieve stress. And sometimes differences in the approach to sex may cause conflict. To relieve stress, participate in sports activities, practice Tai Chi, or even take a yoga class or a meditation class. Get your rest. You want to get plenty of rest. Those with a hectic lifestyle don't always have time to get the right amount of sleep. Being busy also makes it difficult to make time for sex. People who balance work with caring for aging parents or young children are often left exhausted, which can lead to a reduced sex drive. Boost your energy and sex drive by taking naps and when you can, and eating a healthy diet in high protein and low in carbohydrates, right? Keep your relationship in check. After you've had an argument with your partner, chances are you're not in the mood to have sex. For women, sensing emotional closeness is important to sexual intimacy. This means unresolved conflicts can affect your sexual relationship. Communication is essential to building trust. It's important to prevent resentments from building up. And as I mentioned earlier, I think it's also vitally important to consult your physician, right? Talking to a doctor, even if you're taking a natural approach to boosting your sex drive, it still might be a good idea to talk with your doctor. They can help you identify underlying problems. And too many of us do not go to the doctor to speak about our sexual desires. We might go for our physical health or our mental health, but it could be a combination of both, but too many don't want to speak about it. But you might need to. Your doctor may suggest some strategies for enhancing your sexual health. These may include communicating with your partner, making health lifestyle choices, and treating underlying medical conditions. Knowing the root of the problem affecting your sex life will make it easier to find a solution. Now, nothing works first time around. So there's going to be a trial and error situation that you come across. There are a variety of different approaches that may enhance your sex drive naturally. However, it's important to remember that every couple is different. It may take a little experimentation to find out what works best for you. If you decide to do prescription drugs, remember that desire is at the core of sex. It's important to remember that a little blue pill may not be the answer if emotional issues are affecting your libido, right? If you got too much on your mind, or if you have a lot of fear of performing, anxieties can result in frustration in the relationship. If you're a woman with low sex drive, you may have a condition. So, when being diagnosed, it's important to understand you may be diagnosed with hypoactive sexual desire disorder if you frequently lack sexual thoughts or desires. And the absence of these feelings causes personal stress and distress. Whether you fit in this medical diagnosis or not, your doctor can look for reasons that your sex drive isn't as high as you'd like it to be and possibly find ways to help. So during the diagnosis, you could, number one, do a or perform a pelvic exam. And during a pelvic exam, your doctor can check for signs of physical changes contributing to low sexual desire, such as a thinning of your genital tissues, vaginal dryness, or pain triggering spots. They could also recommend testing. Your doctor may order blood tests to check hormone levels and check for thyroid problems, diabetes, high cholesterol, and liver disorders. And if necessary, you may be referred to a specialist. A specialized counselor or sex therapist may be able to better evaluate emotional and relational factors that can cause low sex drive or desire. Now, when it comes to treatment for women, women benefit from a treatment approach aimed at the many causes behind this condition. Recommendations may include sex education, counseling, and sometimes medication and hormone therapy. See, sex education and counseling is basically talking with a sex therapist or counselor skilled in addressing sexual concerns, which can help with low sex drive. Therapy often includes education about sexual response and techniques. Your therapist or counselor more than likely will provide recommendations for reading materials or couples exercises, couples counseling that addresses relationship issues, and may also help increase feelings of intimacy and desire. Now, when it comes to the medications, your doctor may want you to review the medications you've already been taking to see if any of them tend to cause sexual side effects. Antidepressants cause that. Uh, Prozac may lower your sex drive. Switching to another drug, a different type of antidepressant, usually improves sex drive and is sometimes prescribed for women with sexual interest arousal disorder. Along with counseling, your doctor may prescribe a medication to boost your libido. One such pill may be Adye, a pill that you take once a day at bedtime, and the side effects include low blood pressure, dizziness, nausea, and fatigue. Drinking alcohol or taking diflucan, which is a common medication to treat vaginal yeast infections, can cause and make side effects worse. Vyleesi, which is an injection you give yourself just under the skin in the belly or the thigh before anticipated sexual activity. Some women experience nausea, which is more common when you receive the first injection. However, the second injection, now be cautious because some of the other side effects include vomiting, flushing, headache, and a skin reaction at the site of the injection. There are women who do hormone therapy, and this is basically dryness or shrinking of the vagina. One of the hallmark signs of genitourinary syndrome of menopause, which is otherwise known as GSM, might make sex uncomfortable and in turn reduce your desire. Certain hormone medications that aim to relieve GSM symptoms could help make sex more comfortable, and being more comfortable during sex may improve your desire. Now, possible hormone therapies include estrogen, which is available in many forms, including pills, patches, sprays, and gels. Smaller doses of estrogen are found in vaginal creams and a slow releasing suppository or ring. Your doctor can help you understand the risks and benefits of each form, but estrogen won't improve sexual functioning related to hypoactive sexual desire disorder. Now, when it comes to testosterone, the male hormone testosterone plays an important role in female sexual function. Even though testosterone occurs in much lower amounts in women, sometimes it's prescribed off label to help lift a lagging libido. The use of testosterone in women is quite controversial. Taking it can cause acne, excessive body hair, and mood or personality changes. There is another option called Osphena. Taken daily, this pill can help relieve painful sex symptoms in women with moderate to severe GSM. This medication isn't approved in women who have had breast cancer or who have a high risk of developing breast cancer. It is important to state that your lifestyle may need some changes. As mentioned earlier, exercise to improve stamina and body image, less stress, finding a better way to cope with work stress or financial stress, any stress that you have, communicating with your partner, learn how to communicate in an open, honest way, set aside time for intimacy. Scheduling sex into a calendar may seem boring, however, it might be necessary, and add a little spice to your sex life. Try a different sexual position, a different time of day, or a different location for sex. Ask your partner to spend more time on foreplay. If you and your partner are open to experimentation, sex toys and fantasy can help rekindle your sexual desire. It's important also to note that ditch those bad habits, smoking, Illegal drugs and excess alcohol can also dampen your sex drive. Ditch these bad habits. Get rid of them. Give your sex drive a boost and improve your overall health. Now, there are alternatives to consider, alternative medicine, right? When it comes to low sex drive, which you might have to go to a Chinese herbal store to discuss that with the specialist there, or talk to your family doctor. Herbal supplements, right? One particularly called Ablamil. This product has estrogen-like effects on the body. While estrogen may boost your sex drive, it may also fuel the growth of certain breast cancers. So be careful. Another choice is a botanical massage oil called Zestra. It's applied to the clitoris, labia, and vagina. One small study found that Zestra increased arousal and pleasure when compared with a placebo oil. The only reported side effect was mild burning in the genital area. You need to have support when you're dealing with low sexual desire. Coping is important. Low sex drive can be very difficult for you and your partner. It's natural to feel frustrated or sad if you aren't able to be as sexy and romantic as you want or you used to be. At this time, low sex drive can make your partner feel rejected, which can lead to conflicts and strife. And this type of relationship turmoil can further reduce desire for sex. It's important to take into perspective that fluctuations in the sex drive are a normal part of everyday relationships in every stage of life. Try not to focus all of your attention on sex. Instead, spend some time nurturing yourself and your relationship. Go for a walk, get a little extra sleep, kiss your partner goodnight before you go to bed, make a date night at your favorite restaurant. Feeling good about yourself and your partner can actually be the best foreplay. And how do you prepare for that appointment? Primary care doctors and gynecologists often ask about sex and intimacy as part of a routine medical visit. Take this opportunity to be candid about your sexual concerns. Let them know what's going on. If you can't talk to many people, you can talk to your doctor. Confidentiality is assured. If your doctor doesn't broach the subject, bring it up. You may feel embarrassed to talk about sex with your doctor, but this topic is perfectly appropriate. In fact, your sexual satisfaction is a vital part of your overall health and well-being. How do you prepare to talk with your doctor about this subject? Well, first of all, I strongly recommend you take note of any sexual problems you're experiencing, including when and how often you usually experience them. Make a list of your key medical information and include any conditions for which you're being treated and the names of all your medications, vitamins, or supplements you're taking. Consider questions to ask your doctor and write them down. Bring along note paper and a pen to jot down information your doctor may be discussing with you. Some basic questions to ask your doctor would be, what could be causing my problem? Or, will my level of desire ever get back to what it once was? What lifestyle changes can I make to improve my situation? What treatments are available? What books or other reading materials can you recommend? And just be prepared, because your doctor is going to also fire some questions back at you. They might ask you, do you have any sexual concerns? Has your interest in sex changed? Do you have trouble becoming aroused? Do you experience vaginal dryness? Are you able to have an orgasm? Do you have any pain or discomfort during sex? How much distress do you feel about your sexual concerns? How long have you experienced this problem? Are you still having menstrual periods? Have you ever been treated for cancer? Have you had any gynecological surgeries? When it comes to low sexual desire in men, there are a few things to consider. Some of the reasoning could be related to work. Works too much, causing him to be stressed and not getting enough sleep. As well, if he has shift work, this requires him to work at odd hours, long, excessive hours. It's just imbalanced. So that's going to affect his stress, his sleep, his energy, and that might also ultimately impact his desire to have sex. It may be quite possible that he doesn't eat enough zinc. Zinc found in oysters, beef, spinach, and nuts is directly associated with testosterone, right? And there have been studies that find zinc supplements resulted in a testosterone increase in athletes, and the same could be done for your partner. Just have him speak with the doctor about his zinc intake. He might need to take in some more zinc. You think? If your man has a tendency to pull away from you, this could be a sign that he's really not into you, right? People are surprised to hear that men yearn for intimacy just like women. They do. And if they don't feel close to you, they're not going to want to have sex with you. Now, we talked about exercise being a good thing for men. However, in some cases, there have been studies that have shown the negative effects of over-exercising. Men engaging in long and strenuous workouts were more likely to have low libidos. Look at the commitment that they're doing. They're in the gym so long, they're committing, sometimes addicted to those exercises, right? And what happens is they spend so much time in those gyms, right, that their libido can be lowered. You understand? Because they're working out. They're exhausted. They're burning energy. By the time they get home, they don't want to have it half the time because they want to get their rest. So sometimes that exercise regimen that's in place could backfire on your relationship, especially in relation to sex drive. And watch it if your man is staying up too late. If he's up there watching television or if he's on the computer too long, without a good night's rest, nobody, and I do mean nobody, is going to be in the mood for sex. Snoring, often the result of sleep apnea, has been linked to reduced sexual satisfaction, especially in older men. So if he does have sleep apnea, get him a machine, a CPAP machine. Get him diagnosed. Get him tested. Make sure he's getting enough rest. Maybe he's overtired and he doesn't even realize that he has sleep apnea, which means he's not getting enough sleep. He's not actually getting into REM sleep. So he needs to make sure he's getting proper sleep. And I don't mean just hours. It's his health. It's going to affect his overall health. And that includes his sexual desire. We also have to talk about porn. If he's watching too much porn, the studies have shown that watching porn is linked to a higher libido. However, there's also another study that says that an addiction to porn can have a detrimental effect on his desire for sex, right? Men have been found to suffer from sexual anorexia, fear about sex that limits the desire after excessive porn usage. I know some of you women may not want to hear that, but if he's not into you, he may be into somebody else. If he's still into his ex, there's a problem in the bedroom, and it may be bigger than you think. If your partner hasn't taken the time to properly heal from a breakup, that desire to be intimate with you might wear over time. One of the other problems could be is that your man may treat sex like a chore, which, keep in mind, there should always be a degree of novelty in sex. A low libido may just mean that your partner's bored in the bedroom. So you're going to have to spice it up. Try a change of scenery. Go on vacation. Take a weekend cruise. Do something different. Change environment. You have to treat sex romantically on some level. Change it up. If your man has some mental health concerns, then those need to be addressed first. But it is important to understand that their depression or anxiety struggles that they may be encountering may throw off their sex game. When dopamine levels, this chemical that makes people happy, are low, someone's craving or enjoyment of sex will not be up to par. Their sexual desire will be negatively affected. And smoking is problematic. Regular smoking lowers a man's desire for sex and overall sexual performance, right? Nicotine, the addictive drug in cigarettes, is a fault. It's the issue. And some of the topics that a lot of men don't want to talk about is their reproductive issues, right? Their ability to perform. See, it's not just something older men face. Men well over 40 are also dealing with this problematic condition. Without properly taking care of the issue, your partner may be experiencing stress or lack of self esteem. They may have hindered their sex drive because maybe they're feeling they have ED, erectile dysfunction, but they don't want to take care of it. They don't want to go and get looked after. Maybe they're too proud, their ego, whatever it is. If they don't deal with this issue, then that will definitely impact the bedroom and their desire to have sex with you. And another substance that's going to be problematic is drinking. If they drink too much, they got to stay away from the drinks. It has negative effects on the hormone regulation in their reproductive system. Excessive drinking is harmful. And if your man has poor posture, it doesn't only have a negative repercussion for your spinal health. In fact, research has shown that people who sit up straight had higher self esteem, more arousal, and a better mood overall. And watch out for men who are on medication like antidepressants or antihistamines. Those are medications that have unwanted side effects, which include a decreased sex drive. Well, we've had some pretty good conversation on low sexual desire, and I think we've covered some good material today. And I want to say thank you to my listeners and be like the wise old bird, spread the word. All right. Thank you for listening and take care.